Hello, Aaron. Good to have you with me today.
Nice to see you again.
So, Aaron, let me explain first of all to any of your viewers. This is Quakerology. So, I basically have this channel which looks at issues within the Quaker Church here in Britain mainly, but as you all know, there are US Quakers as well and all over the world. And we're a kind of a left-leaning liberal kind of church, so that's kind of the conversations that I have. I'm particularly interested because am I right to call you perhaps a detransitioner? You have a big account and lots of followers. Would you like to kind of introduce yourself and say how you describe your work at the moment?
Yeah, I'm not sure if I'm using the word detransition or not, and I'll explain why.
Okay.
Um, I mean, in short, my story is, it's hard telling my personal story because personal narrative is always challenging, and as I integrate new information and learn things and through conversations, my own studies, I integrate that information into my story, and it sometimes reshapes how
Mm.
I think of my past and how I frame things. So, I mean, if someone were to Google me and find other interviews that I've done, my story has changed over the last several years. I've been in the public conversation now since 2019. At that time, I entered the public conversation fully identifying as a trans man. Um, and I became concerned because I'm a registered nurse who specializes in psychiatric care. I was a clinical supervisor for a walk-in counseling program at a clinic that specialized in youth. And we saw an influx of youth coming in wanting hormones, which isn't a service that we had provided previously. Our physicians were interested in serving the population, which at that time became about 30% of our client population. Um, and we were under the assumption that we would be doing detailed comprehensive assessment and diagnosis. And so there were two things that I noticed. One is that the model of care has changed drastically since I went through it 20 years ago. When I went through it, there was comprehensive assessment, a much more careful process, and mostly for adults, not children. So that was a shift, and our understanding of what trans means has changed a lot over the years. And so I was met with backlash because I wanted to do comprehensive assessment and because I have an understanding of different pathways to this thing that we call gender dysphoria. And 20 years ago, that was just common sense. But when I started to speak like that, I was immediately kind of branded as a bigot and told that I was gatekeeping services. But the youth that I was seeing were very complex with multi layers of things going on for them. Many of them came from trauma backgrounds. A lot of them I was keeping stats on the side of my desk, and a large proportion of them had things like ADHD or autism or came from severe trauma backgrounds. And many of them, because in my day, amongst the women who were medicalizing, it was really just very gender non-conforming butch lesbians, largely in response to how we were treated in society. And the youth that I was seeing, 70% of them were girls, which is new. It had primarily been men and boys who were showing up to clinics. So that is a novel presentation. And most of those girls were same sex attracted, but very few of them were even gender nonconforming. I mean, gender nonconformity is just an organic aspect of personhood. It's part of the natural diversity, and we see that in every culture throughout history. That some people just fall outside of the cluster of traits that we think of as male or cluster of traits that we think of as female. And I was one of those. I was from a textbook point of view, I was a classic what we think of as a trans person. I had a very strong sense that I either was a boy or some mistake had been made and I should have been a boy from age 3 onwards. I was obviously gender nonconforming to everyone around me. So this isn't really a battle over whether or not that experience exists. It absolutely does exist. And in my childhood, there was no social media. There was nothing taught about this in school. So that was just a organically occurring phenomenon that I experienced that. So the question isn't whether or not that experience is real. I think the question is, what does that experience mean? And that is what's being battled out in society today, is a battle over meaning. And my understanding of that experience, it's common for gay and lesbian people to experience that, especially in childhood. It's part of the developmental psychology of homosexuality. So what I'm opposed to, I mean, I have a very pro-human approach. I'm not coming from a place of hatred. I just think that the way that our society has shaped meaning around that experience is incorrect and a harm to many young people.
So you've come to a viewpoint that it's harmful. So do you want to say a bit more about that? I mean, in what way do you say it's incorrect and is harmful? I mean, one of the terms that's being used is gender as an ideology. Is that the kind of thinking?
It is an ideology, and I'm old enough, I'm at 52 now, so I'm old enough to remember the evolution of thinking around this. 20 years ago in my day, was when I was a young student in my early 20s in university, that's when this new program called queer theory entered into the universities and when I studied it. And at that time, I mean, I came prior to that, I mean, I had been living as a lesbian feminist for a number of years and understood myself through that framework of understanding that there's an enforcement of how men and women should be in society. We have expectations about how women behave and look and how men behave and look. And debates over how much of that is biological in nature and how much of that is social in nature. And some of the feminist scholars, like Monique Wittig, pointed to the fact that for lesbians, we exist outside of that framework of meaning because that framework presumes heterosexuality. And lesbians, by our nature, are atypical, not just in terms of who we want to partner with, but we're often gender nonconforming in other ways. And so we exist outside of a framework of meaning. So she pointed to that, but where it fell short was there was no new construction of meaning for us. And I very much felt that, felt alien and othered by society. And experienced extreme homophobia at times in my life. What queer theory did was it picked up that ball from feminists and tried to construct meanings, but it was still very grounded in the realities of biological sex and sexual orientation, and that really appealed to me. So there was a book written by Judith or Jack in air quotes Halberstam called Female Masculinity, which included those of us that medicalized under the banner of we are just masculinized women. That's how I understand myself. And even when I started to take testosterone, that's still how I understood myself. And I made a choice to medicalize mostly in response to how I was being treated, and was looking for ways to just get on with my life where I didn't feel anxiety leaving the house because I knew I wasn't going to be harassed. So over the years, the queer theory has really changed into this, what we call now gender identity, as though all people have this mysterious gender identity, and that spiraled off into bizarre gender identities like cake gender. And there's now like an infinite number of identity categories and the focus on identity and really de-centering the reality of our bodies, the material reality of our bodies. And that's what I disagree with. It's redefining what it means to be human if we're not starting from the reality of embodiment.
Yeah. And I wonder, I mean, you might not want to get into this, I don't know, but I don't know how much of this is a spiritual or religious thing for you. I mean, you're talking here about kind of reality. I just wondered, and that kind of at some point in your journey, that key moment of medicalization. I wondered if it is it a spiritual thing for you at all?
It's a good question. I am a Christian. I was baptized late in life as an adult. So I definitely, think of things through my own spiritual beliefs and my Christian
Mm.
faith. There's different ways of looking at this through a Christian lens. Some Christians would very much want to prioritize the body and the realities of male and female, but the other dimension of Christianity is a social model. Jesus gave us a blueprint for a new arrangement for society that included the new, included those that were considered untouchables and unclean in society. So there's different ways that we can look at this from a Christian perspective in terms of inclusion and caring for people. I don't really have a spiritual framework for that experience of incongruence or why I medicalized. I think that was mostly social, just trying to navigate the world with the least amount of harassment and violence as I could.
Mm.
But I somewhat argue that this new way of thinking is in itself has characteristics of a religion. This belief that we all have a gender identity that's similar in concept to like having a gendered soul,
Mm.
as though we have a male or female soul that can or cannot be in alignment with our bodies.
Yeah.
And even some of the rituals, in workplaces when we go around the circle talking about, asking for our pronouns, it has a kind of a spiritual quality similar to when in
Mm.
church, but when all rise to the Christ candle, like it's become ritualized in society that has a religious flavor, and it's become a dogma in which to merely question those beliefs is seen as being like a heretic.
Yeah. Yeah, it certainly feels like it's not possible to question even having this conversation. It feels, quite an edgy thing to do still,
It does.
which
But
is,
even amongst the trans population, I mean, I know that your church wants to be inclusive of people and care for people, which I absolutely appreciate and agree with. But one of the things I think I'd like to stress is even amongst those of us that are trans and have medicalized, there's differences of opinion amongst us. Some of us accept the reality of our biological sex, some don't, some really believe in this gender identity concept. Some of us believe in more of like a medical model that we have a condition that requires treatment and accommodation. So there's a broad range of ways in which we've constructed meaning for ourselves through this
mm,
experience. Um, and so I think when we accept this gender identity model wholesale as the only way of thinking about this, we also marginalize some trans people who don't necessarily understand their own experience through that framework, because there's multiple frameworks that we can through which we can understand this.
yeah, that's really interesting. I'm just wondering, do you think that medicalization is kind of a key moment in most people's journeys then? Because I've heard this idea that people who don't medicalize, but then move away from some kind of maybe social transition, might be called this term desisters. Is that a term that you use, desistance rather than detransition?
I think that would be so the difference between the word desistance and detransition. Desistance, I think, happens between our ears. Desistance is something um, that we simply change our mind about the framework of meaning. and had maybe once identified as trans according to this framework, and then those that change their mind and maybe think of it in a different way. Detransition, I think, implies a reversal of what we've done medically. But the reality is, especially for those of us who are female who took testosterone, the effects of testosterone are pretty powerful. And I mean, it changes our facial structure, it changes, and I have male pattern baldness and a full beard and my voice changes. And so these changes, for the most part, are permanent. For me to reverse any of it would be a whole other medical pathway, which is largely experimental. There aren't many physicians who do detrans care. We don't really know. I mean, I've been on testosterone for 20 years. I've been off of it now for 18 months. But for me to take estrogen, we don't really know what that impact on my body is going to be. I've had multiple surgeries. I don't know what would happen to my body. Any surgical procedures would be entirely experimental. I don't have breast tissue anymore. I don't have a uterus or ovaries anymore. And I had genital surgery as well. So the least invasive of the options that were available to me. None of those organs are going to grow back. The hair on my head is not going to magically regrow. I'd have to have electrolysis on my entire body. And all of those procedures would be paid out of pocket, thousands of dollars out of pocket, and are largely experimental because we don't have billing codes for those procedures. And so it wouldn't be covered. In Canada, we have a socialized healthcare system in which our government pays for procedures, but none of that would be covered. So for a woman to detransition and want breast implants, for example, she'd have to pay thousands of dollars out of pocket for that. So Kira Bell, who's maybe known to you as a UK detransitioner, she said something very insightful, that detransition, people have a perception that detransition means a full reversal of what we've done. But I think the more accurate way of understanding it is it's just stopping what we've done, because to a large degree this isn't reversible.
Yeah. I mean, I must admit that, just hearing you talk about that, there's certainly a further marginalization, I suppose, you become an even smaller group of individuals who are on this journey. And this is the project that you've just started, isn't it? I've just heard you saying a bit more about a new project that you're starting supporting people in your position.
Yeah, so there are a growing number of services aimed at detransitioners. So I want to fill some of the gaps. So my project isn't focused on detransition, though I would certainly support anyone that wanted to do that. But my project is focused on trans men who are making the paradigm shift to accepting the reality of their biological sex, and offering another framework of meaning. I've returned to feminism. I think feminism provides a framework that makes sense to me. And so it's a project aimed at, because what I'm hearing from a lot of trans men is when they start to make that paradigm shift for themselves out of this queer way of thinking, when they've developed their entire self-concept around that model of thinking. Now that's a political movement, this queer way of thinking. It's a political movement. And history tells us that no political movement lasts forever. No philosophy or philosophical framing lasts forever. So in the UK, things are changing, back to more sex-realist perspective. US, that's also happening. I think we need a necessary return to just basic reality. And when trans people have created their entire self-concept on this political movement, it can be quite disorienting and distressing for them when that starts to crumble and those threads get pulled. Because the entire foundation that they've built their identities upon starts to crumble. So I want to create a space accepting that many trans men are happy with their transitions, and I'm not trying to coerce anyone into feeling differently about that and to detransition, but I want to create a space for them as they're making that paradigm shift to just accepting the reality of their sex. I want to provide a space where, in the midst of their confusion, disorientation, and anxiety about that, they have a place to go where they can just feel supported and talk about it and ask questions without feeling like I'm going to push or pull them in any direction.
Yeah.
It's a process they need to go through. And that space doesn't seem to really exist. And I'm hearing from a lot of trans men that when they start to think about this differently, they feel very isolated and alienated, because we all know as soon as you start to question this framework, there's immediate backlash. We're immediately branded as bigots. And so it's hard to even find each other, because as soon as in order to find each other, we have to be able to speak out loud what we believe in order for others to say, well, yes, I agree with you. And so it's hard to find one another. So I felt like something needed to be created that has a bit of a public presence so that we can start to form some community amongst one
Yeah.
another, support one another, and just have conversations.
So what is that like then? You said about kind of starting to make a paradigm shift, which is quite confusing. I mean, I must admit it, it does, even just hearing you speak about that, it gives me an emotional reaction of just real compassion and sadness, really, in sense of that must be tough thing to go through, especially as an adult. Um, because mostly we think that, adults make reasonable choices and reasonable judgments about their own lives, and just to think that you want to reframe things, it does seem at the moment that it's harder to be accepted for this shift than the original shift of questioning your gender in the first place. We've moved into a space, I think, certainly within Quakers, that anybody who wishes to detransition, for a better word. I know it's a problematic word, but it's very difficult. It's like a new coming out experience, isn't it?
It
Um,
is, and it's coming out with a very little support.
mm, yeah,
And I mean, the the debates about this, the culture war, is becoming quite vicious, um, almost to a point where I worry that it's going to turn into very real violence. And I hope that's not the case, but that just feels like that's where it's headed. And so it is very difficult, because when we start to make the paradigm shift, it's so easy for us to become politicized and taken advantage of by political players. Um, so I caution detransitioners to be careful of that, and to not become public too fast, too soon, because people will swoop in and want to politicize them. And it's difficult when I first entered the conversation. Like I said, I was still identifying as a trans man. I still use that word, just for lack of a better word. I mean, I'm detransition. The reason I don't use the word detransition is, I'm not reversing anything medically. I don't want more medicalization. I've already given so much of my life to medicalization,
yeah,
especially to experimental medicalization. There may be, should I attempt to reverse any of this, there could be complications, and I'm just
yeah,
not interested in doing that. So I don't. I'm not looking for another identity label, and detransition can do that. It can become something that people really identify with as an identity category. Um, so I still sometimes call myself a trans man, just because I know that I'm male passing
yeah,
in the world. Even though I know that I'm female, I know that I'm a lesbian, I know why I did this, but I still tend to use the word trans man just because, just for lack of a better word. I mean, it's complicated reversing this, because,
mm,
I mean, just to give you one example, I mean, until recently, I was working for a locked geriatric unit that specialized in dementia care. And so, working with a few dozen patients with dementia, I'm not looking the way I do. I'm not going to ask them to call me she and her. It wouldn't be fair to them. which means that I also couldn't have the nurses call me she and her because that would confuse the patients. So reversing this is politically, I feel a lot of pressure to do X, Y, and Z, but I have to make choices just on my own day-to-day reality and what makes the most sense and what's going to cause the least disruption. And it's very complicated. Whereas making the initial transition, that's a lot simpler because the changes that were happening to my body to masculinize my appearance facilitated my movement into male social spaces. To go backwards, knowing that very little of this is reversible, to go back into female spaces is very challenging, especially lesbian spaces. You know, my voice sounds male, my appearance is male. So integrating into a space where my appearance does not match those social spaces is a lot more challenging than the original transition. And so I have to be realistic about that. That when I appear male, the world is going to expect certain things of me. And so I have to roll with that to the best of my ability.
But you know, there's a degree of self-acceptance there, which feels to me really, you know, I mean, in a spiritual sense, I suppose we're on a journey towards wholeness. And it feels to me like this notion of, you know, just stopping with the medicalization, even if that's some attempt to go back somehow. It feels good, you know. It feels good to hear you say just to accept where you are and what you've done and why you've done them and just to accept that, really.
Yeah.
What do you mind saying a bit more about what the process of this paradigm shift was for you? What made you suddenly start to think of biological sex as a reality?
It certainly wasn't a sudden process. I mean, like I said, what initially concerned me and woke me up was working with the young people, and seeing so many of them. I mean, I have friends who medicalized around the same time I did, 20 years ago, who have since realized that their decision was influenced by childhood sexual trauma or an autism disorder that wasn't diagnosed at the time, and they're years later unpacking their experience. So that's in the back of my mind. It was certainly in the back of my mind when I was working with the young people. So if I have a young person in front of me who says I was sexually abused as a child or I have an autism diagnosis, I'm thinking, well, 20 years from now, are you going to regret this like my friends now do, right?
Yeah.
So I wanted to work with them on the front end to unpack all of that,
Yeah.
rather than have them slowly unravel that for themselves over the next 20 years and come to a place of regret. And to me, that just felt like common sense, ethical practice as a nurse to,
Yeah.
to really help them, especially when they're minors, to help them understand the full implications of their decision for the rest of their lives. It's not a neutral decision. There are complications, especially when you get into the territory of the genital reconstruction. Those procedures come with a very, very high rate of complications. Like in my country, we only have one surgeon. Well, at the time, only had one surgeon that was performing those procedures. And when I finally came up on the wait list, I was on the wait list for 10 years. When I finally came up on the wait list, they told me that they were no longer sending patients to that surgeon because there had just been so many complications and complaints about outcomes. So they were trialing sending us down to 2 surgeons in the United States. We had a choice, 2 or 3 surgeons. So I chose one. And I'm told, I mean, every single person that I know who went down there for surgery came back with complications. I'm told, I think I was told by the health authority it was roughly 90% of those that they sent down there had complications, some of them quite major. So these aren't neutral decisions. I did have some health problems as a result of long-term testosterone use, with high cholesterol, and I've just been diagnosed with very early stages of dementia, which is what that hadn't been discussed with me is, and maybe it wasn't even known 20 years ago, that long-term testosterone use in females does increase our risk of
Mm.
dementia. I'm only 52, so that's very early to be.
Yeah, yeah, I'm so sorry to
I,
hear
I'm
that.
I'm hoping that will cease. I'm doing work to recover my memory, which has been helpful.
Sure,
Um, so now that I'm off testosterone, that may not progress. So I'm hopeful
sure.
that I've caught it in time to actually do something about it and reverse it, or at the very least pause it.
But of course, at least you are in the position that you've put yourself in the position that you can talk about this and you can share this because my observation is that many people who've made these decisions are now really doubling down and refusing to talk about that there are no downsides at all. They kind of claim that it's all positive and light and then you get a space where you can't even share the difficulties that you're facing, which seems really awful. Um, so I really appreciate the fact that you want to create this space for people to be able to share the realities of this. I'm just wondering, one of the things that I'm really concerned about is this kind of welcome, if you like. How do we create a space which um, is welcoming, not only of the people who are exploring gender for the first time, but maybe exploring gender for the second time. I don't, that's perhaps too simplistic way of looking at it, but how do you not kind of close these conversations down, um, in a way that people who are not completely invested and completely up to date can lose track, can't they, of the complexities here? Do
Yeah.
you have any thoughts about what is a welcoming and um, what kind of affirmation does it involve, for example?
Affirmation is an interesting word because that word comes out of uh, this new way of thinking about things. That affirmation, what does that mean, right? Does that mean that we're just going to politely use people's pronouns? Does it mean that we completely buy into this idea that you actually have this mysterious soul in which you are a male trapped in a female body? So what does that word mean? I think people struggle about inclusion for trans people as though we're in a way that in itself is dehumanizing, that people feel like they have to tiptoe around this issue
Mm,
in a way that they maybe don't with other populations. I think, as with all people, we have to meet each individual where they're at, and we have a tendency these days to identity politics to lump people into groups, which is very different from social justice movements in the past.
mm,
When Martin Luther King Jr. gave his famous speeches, talked about liberty on the basis of individual character, that the character of the person is what should matter, not the color of their skin. These days, and I think that early civil rights movement for homosexuals was similar, that yes, I'm gay, but I want you to evaluate me on the basis of my character,
mm,
not on my sexual orientation. Don't just lump me into a group of people as though we're all within those groups all the same. We're all individuals, and I want to be seen as an individual. These days, we tend to group people now by the color of their skin, or their sexual orientation, or their trans
mm,
status, as though we are all the same within those groups, that we're all equally disadvantaged within those groups, that we're all equally oppressed within those groups, and we're not. We're individuals with our own ideas and our own advantages
yeah,
and
yeah.
disadvantages. And I don't feel particularly oppressed. I've done really well in my life. I mean, I have a successful career. I attended university. I'm going back to university. I own property. I'm doing well in life,
Mm.
and was married and had kids. And I'm not a particularly fragile or disadvantaged person, and I don't want to be
Mm.
treated as though I am.
Yeah, yeah. It is so interesting, because one of the stories that I've heard, I've been talking to a few people who are coming to, Quaker meetings here in the UK. And so, for example, somebody spoke out about it wasn't probably the word detransitioning, but that idea. And some of the younger people kind of left the room apparently. So there was some kind of upset around even the notion that there might be some biological reality, and even that being raised in the room. I mean, it has happened to me. I've said something publicly like, I don't believe it's possible for human beings to change sex. And that is enough for people to leave the room, leave the space. And obviously that doesn't go down too well with all of the bystanders, the people looking on. And this fragility you talk about is really interesting, isn't there? Because there does seem to be a real kind of emotional, dare I say, dramatic fragility about the whole thing.
Yeah, it's sort of it's very black and white, isn't it? It's either you believe in this way of thinking wholesale, or you're a bigot.
Yeah,
And I think, and this is going to be the focus of my academic work, is thinking about diversity, inclusion and social justice, and just through a different framework. That there are different models for social justice. The Bible gives us a model for social justice in itself, and I think where I challenge Christians in my life is to evaluate this societal model of social justice, evaluate that according to the biblical model of social justice. That there are different models. That the original civil rights movement was quite different from this particular way of thinking now that we call social justice, and there are other ways of thinking about how do we value the dignity of every human being. It doesn't have to be you believe in this wholesale or you're a bigot. That I think we need to continue to think about
yeah,
what does it mean to really be inclusive and honor the person.
yeah,
My church reached out to me a couple of years ago. They are also they really believe in the concept of radical hospitality. They are very much an inclusive church from a biblical framework. And they're really struggling with this, that there are ways in which this new social justice model is actually contradictory to the biblical model. And as a community of
yeah,
Christians, which do we prioritize, the biblical model or the model of our day? And what they observed is that the youth pastor raised a concern that a very large percentage of the youth in that ministry are now identifying as they, them, or some other identity category
yeah,
just all of a sudden.
yeah,
And,
yeah,
and they don't know what that means. They don't know, so it raised concern that what is happening, like something is obviously happening to these youth, that they're
yeah,
exploring all these different identity categories,
yeah.
and what does that mean and how do we respond to that?
Yeah. Yeah, we had some kind of letter came out in a publication recently that 50% of our youth group, so that's probably quite a large age range, up to maybe late 20s or something, but 50% of them, were self-identified as trans and only 10% as straight or heterosexual. And I think that that figure has kind of reverberated around. Nobody's talking publicly about it, but the shock of what does this mean,
Yeah.
What does this mean and how do we care for these young people? What kind of teaching and role model and advice and of course, yeah, as you say, 100% belief in this new way of thinking is what's expected. What about 99%? If you lose 1% of your faith in gender ideology, what happens? And it feels like there's a chasm opening almost. And at the moment, we're just falling into this hole. Um,
Different, there's so many different layers to what's happening, but and I don't even understand the full scope of it. But like I said in the beginning, that sense of incongruence is real. Some of us did experience that as children moving forward. Most kids outgrow that. And there have been multiple studies. I think there's 12 studies now to date that followed those kids. Before we were medicalizing kids, they just followed them. And loved them and supported them, maybe supported their families and offered some psychotherapy. But most of those kids, in the ballpark of 85 to 90% of them, just resolved that for themselves by the time they were adults and just became gay or lesbians. So that is what that experience in childhood tends to mean, is it's part of the developmental psychology of homosexuality. So that is one of my key objections to medicalizing kids, is we're interfering with just that natural developmental process in which they may have just resolved that for themselves, and maybe would have continued to be gender nonconforming as adults, but would have resolved that belief of the opposite sex. So we're interfering with that normal developmental process. It's been shown in 12 studies. There isn't a single study that contradicts that. And now we're medicalizing kids. But so that experience is real, but I think how we've come to understand that is quite distorted. And because kids aren't being taught, I wasn't allowed to say to my families, kids that I was assessing, I wasn't allowed to say to them, well, are you aware that that experience probably means that you're gay or a lesbian? I was just supposed to affirm them as if you believe you're a boy, you are a boy.
Yeah.
So that felt harmful to the kids, to not give them an evidence-based way of understanding that experience. Because if someone had come to my family when I was a kid, I think that would have been helpful. When I was going through that and confused about it, what I needed was a way of understanding that. Because when you experience something that you have no framework of understanding, you have no language to describe it, that I think is what causes the most distress, is what does this mean? How do I express that to other people? What does that mean for my social inclusion? If someone had come to my family saying, well, your kid's probably going to just grow up to be gay, that's a very different message than someone saying, well, your kid's trans, they're actually a boy and you should start them on puberty blockers and hormones. So there's that angle, but I think what's also happening with, with a lot of these, like I said, in the youth group, that the majority of the kids were referring them to themselves by other pronouns or identity categories. That aspect, and most of those kids don't have that experience that I had. That has nothing to do with that sense of incongruence. What that is, it's an indoctrination into a way of thinking, and it's become a youth subculture. And that's how we should regard it. It's no different than the hippies or the punks or the mods of eras in the past. It's a youth subculture. And that's how we should regard it. We shouldn't be institutionalizing it and writing it into law. I mean, imagine if the punks or the mods or the hippies of our day, if they have this kind of societal power, that it gets written into law.
There's nothing wrong with the youth subculture, go for
and
it.
It'll run its course, right?
Yeah,
Just don't medicalize it, don't institutionalize it, just let it run its course.
Indeed. And when you say about these things get resolved, I mean, I would say that I'm definitely a part of that. I'm probably best described as a desister, is the sense of I think I probably went through the whole process as an 11-year-old, realized this was just never going to work. This is just never going to be true. One of the things that I said, speaking to as one of these interviews the other day, I made this statement that truth is ultimately kinder than fiction. And of course, you could put a religious spin on that, and truth is another word for God, and fiction is another word for our man-made, human-made constructions. I don't think it went down that well, in the sense that nobody likes to be told that their life is a fiction of some kind. But I do stand by it in the sense that truth and reality is ultimately a loving thing to share with people, even if it's quite hard, that it doesn't move. But I mean, I'm going to get some backlash against that phrase, I think. What do you make of that in relation to this subject?
Yeah, I mean, for Christians, truth always has to be coupled with love, right? That one or the other, the truth without love or love without truth, you're gonna run amok. So those two have to be accompanied together. That how we deliver truths does matter. That we can deliver truths in a very hateful way, and that's not going to be helpful. But truth coupled with love is, I think, is always the right way to go. I think what's going to help us move forward is to make room for gender nonconformity, because I think that's where the fear comes from. And if you understand that I am female and I look like this, I think the fear is that the world is not going to accept a woman that looks like me, that it's not going to accept this degree of gender nonconformity. So I think that's where the resistance comes from, is that if the people feel that trans people feel like if you understood that I'm a man that looks this way or I'm a female that looks this way, that is going to create hatred.
Mm.
So I think the more that we're able to work on the project of really accepting gender nonconformity, that there are people that are outliers, what we expect of our sex,
Yeah.
it gives us a safe place to move into, to
Yeah.
invite us into a place of a new kind of inclusion and acceptance. I think what trans people are struggling with right now is that they can't imagine an alternative. They imagine that truth will mean punishment and hatred and unsafety.
You see, it's really curious you say that because certainly in Britain, the Quakers are known for being quite gender non-conforming. You know, many of us are probably gender non-conforming.
I didn't realize
And
that.
that's why it surprises us. It surprises us, those of us who are sex realist, if that's the new phrase now, um, it surprises us that Quakers have also become very pro-trans and medicalization and irreversible effects is caught up in that. But in a way, the gender non-conforming culture hasn't hasn't helped, I don't think, that much, which is disappointing, isn't it? You'd think, if I wasn't experiencing what I was experiencing in our culture, I would be absolutely right behind you there, saying that is what's going to help because it's going to make you realize that men and women can be however they want to be. But what we've got in Quakers in Britain today is a very pro-trans subculture that has become very dominant, and everybody else is staying quiet, you know?
Well, I think one way of thinking about trans is that it's it's an anti-gender nonconformity problem. Like for me to have
Yeah.
been a very gender nonconforming female and I mean, my decision wasn't based on a single factor. There are a lot of factors that played into it. Very sensitive temperament being one of them. I had a very low tolerance to always feeling othered and the look of disgust on people's faces and some of the bashing that I experienced. I was always the kind of person. As a kid, I prided myself on getting along with everybody. I'm a peacekeeper at heart, and so
Mm.
feeling like an alien really bothered me. And so the solution ended up being, well, if I just pass as a typical man, then I'm not going to experience that kind of disgust. And I was right. I mean, I can now go walk down the street and no one hassles me, no one looks at me funny.
Yeah.
But it's a very extreme response to the societal problem of not accepting gender people.
And what reminds me when you just say that is that out in a big city, perhaps, you simply pass as a man and nobody looks twice and you fit in. Whereas actually, a woman like myself stands out a bit more, and I can still see people now look at me. It's like you're not quite fitting in there. I mean, my hair's grown a bit longer now, but when I've got it short like you, then you know, it looks odd, and you probably don't stand out as much. But what's interesting to me is that from a spiritual community point of view, where you're really close together, you know each other really well, then people would know you.
Yeah.
So it's really curious to me that a spiritual community can't see that this superficial fitting in is not really a way forward for individuals.
Yeah.
I don't think. It feels quite
Yeah,
superficial.
and behind the veil, because I've known a lot of particularly trans men. I haven't known there were very many trans women. Um, but of the trans men in my life, they may feel some relief from their transition. I mean, they weren't expressing to me that they regretted it. They may feel some relief that they can, as I said, just move through the world without being flocked as a gender non-conforming female, which tends to just seems to trigger just this very visceral reaction of disgust in people that needs some examination. So they feel some relief, and that's what I felt when I started to medicalize. On one hand, I felt a lot of regret, not regret, but I felt a lot of grief and sadness, and that's something that we don't always talk about. We think of it, when we are affirmed and medicalized, that it's all a celebration, but behind closed doors, I really felt a lot of grief. I felt in a sense that I was betraying myself. But of the trans men that I know, the social inclusion is really only as deep as the illusion that people believe that we are the opposite sex. And we call that living stealth, where we go through the world and nobody really knows that we're trans. They just flock us as men and treat us that way. But these trans men live in this constant fear of being outed, and what would you think of me if I was outed? Well, it's a huge burden that they carry all the time, even when they don't necessarily regret their decision. But I remember talking to this one trans man that I knew, where he was afraid to. He lived in a house where the landlord owned the house and lived in the he lived in the basement suite, and he was afraid to talk too loud about his own reality in case his landlord overheard it and realized he was trans. Like, to live with that constant fear, it's not authentic relationship with people. Right? It's relationship with people always based on a lie. And that has a huge psychological toll.
I can see that, and I think it's that kind of deception, as the basis for a relationship. I mean, one of the things that Quakers say is that we seek to know each other in the things which are eternal. Not just a superficial knowing each other, but really deeply getting to know each other. And in that respect, I just feel that the most caring, most compassionate way is to really want to know people beyond any superficial transition that they might have done, and to have compassion for the fact that even if they are moving into a more realistic phase of their lives, that transition, 10 years, 20 years, whatever it might have been, as you say, provided relief, provided them some sense of settled period in their life where they could begin to move around in the world more comfortably, and to have compassion for that. But to have compassion that they're moving even further into wholeness, I think is fundamentally a spiritually rich way of looking at it. And the limitation of a superficial life, I wouldn't wish that on anyone.
Yeah. And the natural organic aspect of this is the reality of gender non-conforming individuals. The medicalization part is a technology. That's that part isn't natural. And I do think I reserve the possibility that it is a helpful intervention for some people. I do believe in the concept of bodily autonomy amongst adults who are of sound enough mind to make a decision for their own bodies. So
Yes.
So I'm maintaining that possibility, but people still need a way of. But it is still a technology. Like it's not a natural state.
Yeah. And I suppose people might take different views of this. I mean, I'm of that mindset myself, that I think if adults want to do that, then that's fine with me. And I mean, but nonetheless, from a spiritual point of view, it's just because people can do that. If somebody comes to a spiritual community for spiritual guidance, I suppose I hope that we begin to think about different ways of what is the compassionate way to hold these conversations? I mean, one thing that I think has changed in the last few months, perhaps here in the UK, is that I think no debate has ended. So I think at least now conversations are starting to happen. Have you noticed that?
Not in Canada, no. I mean, I've definitely I've been watching what's happening in the UK. We're nowhere near that here in Canada, um, but hopefully we'll get there.
Mm,
And Canada can't remain an outlier in the world if the rest of the world shifts. We are influenced by media from
mm,
other countries. Hopefully that will start to change, but what no debate creates is a situation of the potential for violence. Because people are growing in the resentment to not feel like they can just think so loud. So I think debate is healthy and necessary to try to resolve conflict and avoid the potential for violence. But I think one of the questions that we also need to be asking ourselves is, why is this impacting women and girls far more than it's impacting boys and men? Why is it that 70% of those that are showing up to clinics are girls or young women? So this
mm.
is impacting girls and women disproportionately, and that really needs to be examined. What is the quality of life for women and girls? What's motivating them
Mm.
to feel as though their lives are somehow different boys?
Yeah. And I mean, you mentioned the girls. I mean, is there anything that, if this is being listened to by some younger people, I mean, I'm sure they would be looking up to you and hanging off your every word, having been through, what you've been through. So, what is the kinds of messages that you give to young people, teenagers, who might be thinking about these issues for themselves?
Yeah, you would think that the young ones would be very interested in what I have to say, but the ones that have really bought into this way of thinking, I mean, it's being taught to them by the media and the school system and our governments. So they've accepted this as this is just reality in the way it is. Because why would all these authorities be teaching it if it wasn't reality? And aren't old enough to have witnessed the evolution of our thinking about this. But the question that I would lead with a lot of the girls that I worked with when they wanted hormones and to live as boys or men, I think a really important question for them is, what is it about being a girl that's making your life so difficult? Because there's always something that's motivating that decision. They're imagining their lives would somehow be better as
Mm.
boys. So I think that was a really important question. And sometimes I'd ask that question and they'd burst out crying. But I think that's a really important starting place, is what's going on in your life? What is difficult about your life right now? Or what is it about being a girl
Mm.
that is so awful for you?
Yeah, and as you say, maybe they are not open to listening just yet, but maybe their parents and their carers and the elders in their church might be able to listen to this. Do you
Yeah,
have
I had
any
one girl,
thoughts
she
for
was
them?
I had been working with for a while. She was one visit away from starting hormones, and her parents brought her in one day, and she was looking very distraught. I brought her into my office and said, "Well, what's going on? What's bothering you?" And she said, "Well, I'm not happy." I said, "Well, when were you last happy?" She said, "Well, when I was a girl." So she was planning on taking testosterone to live her life as a boy. So she said she was happier when she was a girl, but she was still, even though she acknowledged that, she still wanted to go through with taking testosterone. And I said, "Well, what is that resistance? Like, what if you were happier as a girl? What would prevent you from just being a girl?" And she said, "Well, then I'd have to grow my hair long, and I'd have to start wearing dresses, and I'd have to do X, Y, and Z." And I said, "No, you don't. Like, girls, you don't have to change a thing about yourself. Like, if you like short hair, have short hair. If you like wearing hoodies and baggy pants, running shoes, you don't have to change any of that. Girls are allowed to have short hair and wear baggy clothes. And there are multiple ways to be a girl." And I said, you've spent all this time exploring which identity category you belong in. And I said, have you considered exploring what kind of girl you might be? And you could tell that that had never occurred to her,
Yeah.
right? So and I could see this weight being lifted off of her shoulders, and she brightened. And for her to think, well, I get to be any kind of girl I want and avoid these medical interventions, which I think she found a bit scary.
Yeah. With
That was
good
a huge
reason.
weight off of her. And how sad is it that girls don't seem to realize that they have options as girls?
Yeah. Yeah. So, so look, this has been a great conversation. I'm sure it'll be of help to people. If people wanted to reach out to you or to look up your project, how how are you telling the world about this project? Where can they find you?
I have my own website, so aaronkimberley.com. And I'm heading off into grad school in the fall, so these are the kinds of questions I'm going to be thinking deeply about from a feminist framework. Um, and so as I'm writing academic papers, I'll be posting them on there. So people are welcome to check out my website, and there's a contact form there that they want to reach out to me.
Yeah.
Happy to hear.
Well, great. All the best to you for your studies and your and the project and the support that you give to other people in your situation. Aaron, it's been an absolute pleasure talking to you.
It has been a pleasure speaking to you. I appreciate the invitation.
Thank you.